going to be demonstrating the Hill-Rom early mobilization protocol with one of our ICU patients who's on the progressive bed. We'll also be utilizing the LICA overhead ceiling lift system, as well as the Hill-Rom Metadeb 3-modality respiratory pulmonary treatment system. Right now, our patient is at level 3 within the Hill-Rom protocol. So our goal is to test the patient and get them out to the chair. So Brad's going to be my assistant. Brad, let's bring up the whole bed. All right. Tiffany, can you just pull forward a little bit so my patient can follow command, which is a good sign because we're going to be getting our patient out of bed. And Tiffany, we're going to just bring our leg straps up underneath like that. Okay. Crisscross applesauce. Bring in our overhead. We're going to lower down. We're checking our patient's continuous vital signs on the Hill-Rom Welsh Allen monitoring system, which allows us to detect any changes hemodynamically. Good, checked. All right, if our patient wants to participate, we might get them to hold on to the lower green area there. Safety check. 2-person procedure. We're going to bedside dangle our patient right now, just swing over. And Brad's going to lower the whole bed. We're assessing orthostatic tolerance right now in our protocol. Continuing to watch our vital signs. Patients seem to be tolerating it well, no blood pressure pulse change. I'm going to raise up my patient a little bit more. Bring my patient out of bed and over on top of a pair of lift pants, which is part of the clinical process, to prepare my patient for the next phase, which would be upright, marching in place, and ambulatory training again. Right now, our patient also has some respiratory difficulties, so we're going to go ahead and use the Medaneb treatment.
The Medaneb is important so that we can actually get that lower lung, avoid the atelectasis, open those alveoli, so we get that nice gas exchange for proper respiration. These chambers, you can hold here. I'm going to turn it up to more oscillation. Watch my dials, so she's getting the positive pressure. She's just going to breathe normally. And it's actually getting a nice positive pressure through her lungs, trying to open both lungs and both alveoli. Okay. I can even switch it a little bit more, so she's getting a little bit more pulse, and start really opening and start vibrating those alveoli so we can get that more gas exchange until she can take some more deeper breaths, expand those lungs, and avoid atelectasis. Very good. Wonderful. Now we don't need the sling anymore. We have the nice lift pant to protect the patient as she tries to sit up. We're just sizing the sling so she feels comfortable. We'll bring in the LICA guard. Over here. Perfect. Good. I might have the patient start to scoot to the edge of the bed, edge of the chair a little bit. Again, we're not going to pick her up, but we want her to guide her up, and then we can actually have her come to stand, head up, take a nice deep breath. That's where the Medaneb is going to help with us. That's good. A little down. Here, we'll lower it down just a little bit for me. Good. And we're just going to work on some weight shifts, working on that breathing that we did. Head up, no money on the floor. And if she were to go down or go south, it's got her. We can have her correct and auto-correct and still work on her breathing. So we're maximizing both mobility treatment as well as the respiratory, pulmonary, and cardiovascular. Have her start walking, working on weight shifts, transitional movement patterns, reaching back. We're going to lower her down. She's going to do it. The sling's not doing anything. It's just there in case she needs it.
So our patient was just moved to level 5, fully upright vertical ambulation with the Hill-Rom early mobility program. This is part of actual demonstration of the science, the research states that if we do early mobilization in the ICU, progress it all the way through down to the med-surg area, patient will leave the ICU about 35 to 40% sooner than patients who do not receive early mobilization. That will also transfer over into a lesser med-surg hospital stay, over 30%. We believe that significantly helps our hospitals reduce their risk exposure to acquiring other adverse events and reduces their length of stay costs. So thank you very much for the time to listen to our demonstration of the 5 levels of Hillrom's progressive mobility protocol.